Hello. Hello. Hello.
Sir, 2 minutes, sir. We will start now. 7:58, sir. Within 2 minutes, we'll start, sir.
Yes. Yes.
Thank you.
Perspective, especially particularly about this topic that we are discussing, then how do you think we can adopt certain methods and measures so that we can reduce the vulnerability of this section of the children and adolescents? Vulnerability related to behavioral addiction. What is your opinion about that?
Hello, Ramya.
Yes, sir.
Start.
Yes, sir, you can, sir.
Yes. Good evening, everyone, and welcome to today's session. I want to congratulate first organizing committee of IPSOCON 2020 for the wonderful conference last week. Thank you all for attending this webinar today. I welcome Dr. P.K. Dalal sir, our beloved IPS president. I welcome Dr. Gautam Saha sir, Vice President and President-elect of Indian Psychiatry Society. I welcome Dr. T.S.S. Rao sir, General Secretary of Indian Psychiatry Society. I welcome Dr. O.P. Singh sir, Honorary Editor of Indian Journal of Psychiatry. A warm welcome to Dr. K.K. Mishra sir, Honorary Treasurer of Indian Psychiatry Society, as today's chief guest and moderator for the session. Hello, sir.
Good evening.
Sir, I welcome you to today's session, and I'm glad that you accepted our invitation.
Thank you, sir.
Now, I would like to welcome Dr. Suresh Kumar, sir, Director of SciMed and Consultant Psychiatrist, Director of SciMed Hospital and Consultant Psychiatrist, being the speaker for the day. We all know that he is a good orator and has a vast experience in the field of psychiatry with international expertise. He will share his experience and enlighten us with his talk. Hello, sir.
Thank you, Dr. Vishal. Thank you for your kind words.
We are extremely fortunate to have you as a speaker for today's webinar. We are eagerly waiting for your talk, sir. And I welcome Dr. Prasad Rao, sir, President-elect Asian Pediatricians Psychiatric Association, and our chief patron. And thank you, sir, for your continuous support and encouragement, sir.
Namaste.
Sir, I welcome our chairman, Dr. Macheswala, sir, to whom I deeply indebted, who has been very encouraging all the time. I also welcome our co-chairman, Dr. P.N. Shukla, sir, who has been very encouraging all the time. I'm happy be associated with our direct council member of Indian Psychiatry Society, Dr. Alim Siddiqui, sir, members of committee, Dr. Vijay Harvi Shettar, Dr. Fanikant Kondaparthi, who have been active in organizing the programs. I welcome you all. Coming to today's topic, as we all know, some amount of stress is necessary for normal functioning because the nervous system apparently needs a certain amount of stimulation to function properly. But stress that is too intense or prolonged can have destructive physiological and psychological effects. It appears that a wide range of stressful situation can lead to various types of disorder, and conversely, a wide range of disorders can result from a given type of stress. Today, I invite Dr. Suresh Kumar sir to elaborate a neurobiological basis of stress and its management. I request Dr. Prasad Rao sir kindly introduce today's chief guest, Dr. K.K. Mishra sir, Honorary Treasurer of Indian Psychiatry Society.
Thank you, Vishal. I think one of the most active committees this year in the Indian Psychiatric Society, as I see, all committees seems to be working hard, but the public mental health education under the umbrella of Vishal, Yusuf Macheswala, and Suklaji are doing at least quite a lot of mental health education to the psychiatrists on the first place, apart from their service to the society. So I deem it a privilege to be part of this multiple webinar programs. Each time I'm there as a patron. First of all, let me just invite all of you and thank Linux for their unconditional support on one side, and Sajjan Commodore Shirod Kumar Mishraji is such a well-known person that he possibly does not need introduction. But I deem it a privilege to just introduce him. As I was going through the Sanskrit meaning of Kshirod, it is the name of Lord Vishnu. It's full of milk. And I can say he is like a doodh peda. He's always smiling. And currently the professor, and like milk, he is so useful to each one of us. And especially honorary treasurer, collecting money to the Indian Psychiatric Society. And I know him for the last two decades and a half. And I see him always energetic, and currently the professor at the Mahatma Gandhi Institute of Medical Sciences at the famous place in Wardha. I have been to that place, and there I found him as energetic. And I'm so tempted to talk about my dear friend, and in a way, is a mentor to large Indian psychiatric community, Dr. K. Suresh Kumar, a person who has studied at Chennai or Madras, the old Madras Medical College, and also in the Institute of Mental Health. He has had the distinction of doing a specialization of addiction psychiatry in the Harvard, if I'm not wrong. And after that, his passion has been to train the about addiction in none other than the People's Republic of China. I have been associated with him, and he has helped me, my Asha Schizophrenia Clinic, many a times. So Suresh, it's really a pleasure to have you as a speaker. And now may I invite our Milky Kshirod Kumar Mishraji to chair, moderate, and I'm sure this topic would get a lot more questions. Already I see members pouring into joining the webinar, and as soon as Mishraji introduces the topic and introduces Suresh, we will have a bank. And with all these things, I would just like to close. Happy Diwali to each one of you in the coming week. We are going to celebrate probably a sedate Deepavali, but let us hope the corona will run away with the smokes enunciated from the Diwali crackers.
Good evening, everybody. I'm extremely thankful to Prasad Rao sir. He's a good friend, good senior, good elder brother. I worked under him as during his presidency for a long time, and we are associated for more than last 2 decades. And I thank Vishal for choosing me for this very important topic, which is important from the everybody's point of view, and more so when the corona has additional stress giving to isolation and all those factors. And at the outset, I must thank all the office bearers, my friends, Professor Dalal sir, and Dr. Gautam, the Vice President, Professor T.S.S. Rao sir, Dr. O.P. Singh, and Dr. Alim Siddiqui for their active participation. And Professor Machiswala sir and Dr. P.N. Shukla sir, my extreme seniors, who has been guiding Vishal in this process. And in the process, Vishal is doing a lot of work under the strong guidance of Dr. Alim, Dr. Prasad Rao sir, and all the two stalwarts of psychiatry like Machiswala sir and P.N. Shukla sir. And all my dear friends, as all of you know, stress has produced so many impact in our life, and the neurobiological changes in the stress has been related long back from the normal hormonal like corticosteroidal changes to going up to the inflammatory process, interleukin, mitochondrial changes, a lot many changes which occur in the biological process of the stress. And I'm not going to detail about that, but Professor Suresh Kumar sir is an expert in this field who will be dealing in detail about those things. And the impact of the stress leads to different changes in the physiological process and the psychological part of the brain changes, which is activated due to the certain changes in the stress process due to the inflammatory process. The physical changes like cardiovascular changes leading to ISD, and endocrine changes like diabetes among the population who have been affected with the long-term thing, and the stress vulnerability. Individual has got a particular vulnerability towards the stress, and the resilience factor. What's a very important aspect in mitigating the stress, which is a part of life. So stress is a part of life. We can avoid it, but due to the strong resilience factor and the stress adaptability produces a lot of changes and save the individual or protect the individual from the physiological effect and the neurobiological effect of stress. So with this brief introduction of the topic, I'll not go long about this thing. And Professor Rao sir already given a brief introduction of Professor Suresh Kumar sir. I know Suresh Kumar sir for long since, and I've listened to him several occasions in South Zone conferences and other national conferences. And just a brief introduction, I think already Prasad Rao sir told he doesn't need any introduction per se, at least in the Indian setup, but he has got a long of reputation in the international society also, and he has worked for the long time for the substance abuse as a teacher, as a researcher, as a like activist. He has worked in the areas of substance abuse, not only nationally. He has been associated with lot many international field in the starting from Sri Lanka, Thailand, other nations where he has been an advisor to them in the field of substance abuse. And presently he is working as the director of PsychMed Hospital at Chennai. So I'll not waste much time with my further introduction. And he's an expert in these areas. And I request Professor Suresh Kumar sir to deal with the subject in his usual manner. Thank you, Suresh sir. Thank you, Vishal.
At the outset, I want to profusely thank Dr. Vishal Akula for inviting me, and my very close friend, Dr. Prasad Rao, for having me in this program, along with Dr. Vishal Akula. My personal thanks to both of you for having me in this meeting. I'm personally indebted to so many office bearers who are here at this point in time, who have made their presence here. I am grateful to Dr. Mishra for taking his time off and being there, being the moderator for this today's program and introducing me and offering some kind words to me. Thank you very much. What I'll be doing is to talk about neurobiology and its management of stress. Now, in my outline, I want to tell you that I want to really talk about an overview of stress. Then I'll talk about stress response system. And I'll then talk a little bit about early life stress, what is known as ELS, which is critically important for psychiatric disorders, and also chronic stress, which again has an adverse impact on the brain. And also talk a little bit about stress and disease before talking about how to resolve stress-related problems and how to enhance stress coping abilities. So that's a large, overview I have, but I'll be, touching upon it. So we have time for questions and answers. First, let me talk about stress and important points. We all know it's been a subject of study for a long, long period of time. It's a popular topic these days. I think every forum you have a talk on stress, and many people who have nothing to do with psychology and behavioral sciences are talking about stress management. It's actually a term that came from physics, and I think it's a concept that was borrowed from like physical sense, stress sciences. You'll see Walter Cannon on your left side and Hans Selye on the right side. These are two great people who contributed a lot to the understanding of stress. Walter Cannon worked from the Harvard University, and Hans Selye worked in the McGill University in Montreal in Canada. These two people, few years apart, contributed significantly to stress. Walter Cannon, I know many of the people in psychiatry know, he came out with the theory of emotion. To him, we owe the fighting or flight response, which all of us are very familiar with. Whenever a person is faced with stress, he either goes through a fright response or a flight response or a fight response. This concept originally came from Walter Cannon in 1915, and it is still holding true. Claude Bernard at that time came up with the concept of interior milieu. And this interior milieu is extremely important, and Cannon coined the word homeostasis. Even though many people tried to change it in what they call as an allostatic processes, it is only confusing the literature. So we still retain the good old term homeostasis, because restoration of homeostasis is fundamentally important. So Walter Cannon's contribution is extremely important of the fighting or flight response and the word homeostasis. And Hans Selye came up with the general adaptation syndrome, which later on came to be known as the stress response and stress response system. He described about the alarm phase, which is the immediate response, and then the resistance phase, and then the exhaustion phase, in which organism actually sometimes collapses. So these are all very fundamental concepts in physiology, which still hold good even today. Let me talk a little bit about what is a stressor and what is a stress response. When we talk about stressor, by definition, any stimulus that's triggering a stress response is a stressor. It could be physical, it could be psychological. And the stress response is what is generated when the brain is receiving something as a potential threat. Not everything is perceived by the brain as a threat. The brain has to see the stressor as a potential threat. So obviously, the perception becomes extremely critical. The perception of stress is dependent on a number of factors. Many of them are intrinsic to the stimulus itself. If the duration of the stressor is longer, or if it is very intense and severe, you probably perceive stress. COVID is a classical example. It's gone on for months, and it is also quite intense because the mortality and morbidity is very high. So the perception is probably true for most people, because they're perceiving it as very stressful. The perception, as Dr. Mishra rightly said, varies according to various individuals, because the same stimulus which may be threatening to me may not be threatening to my wife. So obviously it is dependent on individual susceptibility and vulnerability. So the stress response is a generation of activity by the brain, because the brain has to perceive it as a threat, and the threat perception is related either to the stimuli or to the susceptibility of the individuals. And then, as Dr. Because Vishal talked about in the beginning and said, some stress is very important. It's not stress is always bad. We all know about this Ed Dodson law. In this particular law, we all know optimal stress is critical for a better performance. For a person to perform better in any field, he requires an optimal stress. That optimal stress actually makes individuals to perform at their best level. Whereas with the stress level increases, then the anxiety sets in, disorganization takes place, and the whole performance is seriously affected. So it's very important, if you are a student, if you are a teacher, if you are a performer, if you are an artist, do any work, your optimal stress is going to be facilitating a better performance. Then we also talk about something called as a positive stress. What exactly is a positive stress? Positive stress is always moderate, is usually short-lived, which increases the autonomic activity a little bit by increasing the heart rate, mild changes in the stress hormone. We need to get worked up a little bit. And it happens when you are meeting new people and then dealing with some frustration or getting an immunization shot when the immunization comes through. This is a necessary part of the healthy development, especially in a stable and a supportive relationship. Positive stress is highly important. It's a positive stress which contributes to better bonding between people and the ability to deal with it and have a better resilience and cope with stressors. So these are all positive stressors. There is something called a tolerable stress.
And
Tolerable stress is something
once
when
tomorrow
the stress
program
response
today,
can indeed
get
disrupt brain
medical
architecture.
council, Telangana Medical Council, I'll get that. Normally, I will get it. That's not a problem.
So stress response can actually disrupt the brain architecture, but at the same time, it is buffered by a supportive relationship, which helps in adaptive coping. So here is where, even though it is disrupting the brain architecture, it is really not affecting because there is a supportive relationship that serves as a buffering effect. So here, even after a death of a loved person, or even after divorce, people are able to get through it over a time period because there is an opportunity to recover. So that's why many people are able to withstand many of these difficulties of loss and separation and then frightening injuries and get over it. And then there is a toxic stress. What exactly is a toxic stress? Toxic stress is one where there is a prolonged activation of the body's stress management systems, but also concurrently, there is no buffering protection. And then this brain architecture disturbance leads to a really stress-related physical and mental health problems. So, whereas we require optimal stress for better performance, some of the stress could be positive to perform even better. Tolerable stress is something common for human beings to adapt well. Toxic stress is one thing. In the absence of buffering protection of support, this is where the brain architecture can be very disruptive and leading to physical and mental problems. So when you talk about stress response system, we need to understand the stress response is something which is carried out by the body as well as the brain. And the variety of brain structures are involved in it. The main aim of the brain is to detect whether the given stressor is physical or psychological in nature. That's critically important. The brain has to recognize it as a physical stressor or a psychological stressor because the response pathways are entirely different. And then interpret them as potentially intimidating or threatening. So the brain's first signal is to identify the stressor as physical or psychological and figure out whether it is actually intimidating or threatening. And see this nice like cartoon developed by Godi et al. In 2018, which I think is the best way of understanding the stress system. So the brain first understands whether it's a psychological stressor or a physiological stressor. And then it generates a stress response. If it is a physical stressor, it largely goes through the SAM, which is called as the sympathetic adrenomedullary axis. So here, predominantly, the autonomic nervous system activity is predominant. So for physical stressors, it's primarily going through the sympathetic adrenomedullary axis, and then probably there is a generation of catecholamines. That's what happens with the physical stressors. Whereas with the psychological stressors, predominantly what is being put into activation is the hypothalamic pituitary adrenal axis. And this hypothalamic pituitary adrenal axis will actually generate more of glucocorticoids. And excessive glucocorticoids is going to be toxic to the system. So you see the difference. There could be an overlap. Psychological stressors can also act on the SAMI, but in very little way. The physical stressors can also act on the hypothalamic pituitary adrenal axis, but not in a predominant way. The predominant focus for a psychological stressor is hypothalamic pituitary adrenal axis, whereas for the physical stressors, it is a sympathetic adrenomedullary axis. Both of them are mediated, and then specific receptors are acting, and the body and the brain are coming into play. So after having identified, this is the one. So on your left, you will see the hypothalamic pituitary axis, where the hormone that you are considering are the CRH, corticotropic releasing hormone, and then the ACTH, and then the cortisol itself. Whereas in the hypothalamic pituitary axis, you really have the glucocorticoids being involved. So that's the kind of a thing that you are talking about in the system. So there is a coordinator system. The whole business of this is to restore the homeostasis. So the whole body and the brain is aiming towards the homeostasis restoration. So what does the body do when faced with a stress? The body's response is to mobilize the energy, produce the metabolic changes, and activate the immune system, and suppress the digestive and reproductive systems. These are all very critical, more important for physical stress starts. The energy mobilization is critical, the metabolic changes are important, activation of the immune system is important, suppression of the digestive and reproductive systems are important. This is what happens with the physical stress starts predominantly, can also happen to some extent with psychological stress starts. Whereas when you go through the psychological stress starts, I think the brain is also responding, both in terms of short term and in the long term. And both genomic epigenetic mechanisms as well as non-genomic mechanisms are critical. And these central effects are also combining with inflammatory responses, particularly the pro-inflammatory signaling. And they lead to alterations in the cellular excitability. And also the synaptic and neural plasticity are affected by this process. And the body-brain effects are mediated, only all leading towards adaptation of the organisms and the survival of the organism. So the whole stress response by the body and the brain is gearing towards restoration of homeostasis and enabling adaptation and survival. And I think that's the whole facilitatory mechanism. That's a fantastic way of understanding. I think in everything we can intervene and modify the way the brain and the body responds to stress. And these are all taken into critical aspects when we are working with this. Talk a little bit about neuroanatomy of stress. And I think you need to understand clear neurobiological substrates have been identified in the brain for stress. There is a slightly different network that are involved when there is a physical stress. There is a slightly different network that is involved when there is a psychological stress. The one in the pink is related to the physical stress starts. The one in the blue is related to psychological stress starts. To elaborate it, I think in both physical as well as psychological stress starts, the critical structure is the paraventricular nucleus of the hypothalamus. The paraventricular nucleus of the hypothalamus is critically important. It's a central structure involved in stress because it connects to the autonomic regulation. And I think that's the one which is critical node, which is important for both physical and psychological stress starts. Whereas when it comes to physical stress starts, the central nucleus of the amygdala, which again is responsible for autonomic regulation, is critically important. The structures that are important for physical stress starts are the nucleus of the solitary tract and the locus coeruleus. If you look at the anatomy of locus coeruleus, look at the anatomy of the locus coeruleus, you will understand it is located strategically. It is located strategically in a way that it is controlling the somatic, sensory, and other modulations. So I think physical stress starts, the main structures that are involved are, apart from the paraventricular nucleus of the hypothalamus, is the central nucleus of the amygdala, which is responsible for the autonomic regulation, and the nucleus of the solitary tract, as well as the locus coeruleus, which are all involved in modulating the sensory and somatic modalities. And not only the limbic structures and subcortical structures are involved in physical stress starts, the cortical structures are also important, particularly the prelimbic areas of the prefrontal lobe is critically important for physical stress starts. And also the hypothalamus, because it has to carry the memory of that particular event. So these are the various structures that are involved in physical stress starts. When it comes to psychological stress starts, I think slightly it is different. You'll appreciate the basolateral aspect of the amygdala nucleus of the amygdala, the bed of BLA is the one that is critically important for the, psychological stressors. The amygdaloid complex is important, particularly the BLA. And I think what is really important is to understand the other regions like hippocampus. Hippocampus is critically important to carry the aversive memories. People who have undergone psychological stressors, even as a child, would recollect it vividly when they are an adult. Because unfortunately, the hippocampus has stored the aversive memories very strongly in the brain. So hippocampus becomes an important structure because it carries the aversive memories very strongly. That is one of the reasons people with psychological stressors revisit those aversive memories again and again. Again, the cortical structures like the prelimbic area of the prefrontal cortex, along with the infralimbic area of the prefrontal cortex, are critically important because they have this balancing effect of anxiogenic and anxiolytic properties. Also to remember, this neuroanatomy of psychological stressors have so much to do with the reward circuits in the brain, the nucleus accumbens in the reward mechanism that is involved. So that's one of the reasons why psychological stressors are very much focused on the subcortical areas and also related to the prefrontal cortex, particularly the prefrontal cortex, which is actually innervated. Dopaminergic projections from the VTA and the nucleus accumbens are very, very important. So the important component that differentiates the physical and psychological stressor is the anticipatory condition that is perceived in psychological stressor versus physical stressors, and the ability to be modulated by the reward system in psychological stressors. And the prefrontal cortex disruption associated with anhedonia and aberrant reward-seeking behavior, these are all very characteristic of psychological stressors. Although the prefrontal cortex involvement is very complex, to begin with, there is a top-down control, but then over a period of time, the circuitry switches to bottom-up control when the reptile brain, the cortical, instead of the cortical brain, the subcortical brain takes control, and that's when you're driven all the time by fear in a stress response. So the prefrontal cortex is critically important because bilateral lesions of the prelimbic cortex can increase the plasma ACTH. The lesions of the infralimbic cortex can reduce the corticosteroid secretion. Also, the lesions in the dorsal aspect of the prefrontal cortex can result in anxiogenic effects. The lesions in the ventral sides can introduce anxiolytic effects. So in other words, the prelimbic area inhibits the paraventricular nucleus activity with anxiolytic effects. The infralimbic area stimulates the PVN with anxiogenic behaviors. So that's the kind of a thing, tandem that occurs within the brain. And so, as I said, the basolateral nucleus of the amygdala is very important. That plays a very important role, particularly for anticipatory stressors. And it also, along with the hippocampus, this is responsible for consolidation of the aversive memories. So these are all the ones that are leading to the fear-related behaviors in the individuals. So, and also hippocampus is an important structure of the hypothalamic pituitary axis negative feedback, particularly in the hippocampus. The Amazon CA1 region has very important connections with the limbic structures. That's the one which is critically important for psychological stressors. And hippocampus is critically important for both physical and psychological stressors. We need to carry the memory of it. And then moving on, we also know there is a fundamental difference between male and female in terms of, stress response. We all know about it. I think the way men react to stress is very different from the way women react to stress. The women have larger volumes relative to the cerebrum size in the frontal and medial paralimbic cortexes, whereas the men have larger volumes in the frontomedial cortex, amygdala, and hypothalamus. So that differentiates the stress response in the females is slightly different from males, and that difference could be contributed by neurobiological substrates itself. Okay, and I talk a little bit about early life stress. Early life stress is very important. The stress response orchestrated by the brain varies across the lifespan. Whereas if you get exposed, unfortunately, early on to stressful factors, that can trigger immediate changes. It reshapes the brain, the way it reacts to stress in adulthood. A lot of people who do not cope with stress today had a very negative aversive experience as a child. We all know about it as mental health professionals. That unfortunately is the reason why a lot of people do with maladaptive behaviors as adults when faced with stressful situations compared to people who have been fortunate not to be exposed to early life stress. Exposure to stress during critical periods of development can have long-term consequences. That's why we are really wanting to protect the brain from life stressors at a very early age, susceptible age, when the brain is maturing at the early age. And I think when the child is affected by it during the maturational process, one of the ways in which the stress is mediated is to have its long-term effect on the hypothalamic pituitary adrenal axis system. This could result in cascade of many central and peripheral events releasing to corticosteroids from the adrenal glands. And I think that stress-induced maladaptation actually produces mechanistic basis for altered susceptibility later on in life. So if somebody asks a question, why some people are more susceptible as adults to stress, why do they crack down with minor stress? Why do they crack down with frustration? Why are they not able to withstand any loss and separation compared to other people? I think it may be to do with the biology of early exposure to life stressor, like interrupting with the HPA axis, and the maladaptation of it can produce people to become susceptible to stress later on. So this is very important. It even starts prenatally. We need to understand prenatally, even prenatal stress and perinatal stress is very important. That's why we give so much importance to perinatal mental health these days. So we need to protect the brain from overexposure to glucocorticoids as well. Also talk a little bit about chronic stress. And I think the brain is very different when it is healthy and the way it reacts to acute stress. And the brain is very different in a stressed brain, particularly a stressed brain due to a chronic enduring stressful factor. The neuromatrix is completely different. There are 4 responses. 1, the moment you have a stress, you can deal with it and respond to it, and then, transit out of it, maintain very well. Unfortunately, you can transit from acute stress to a chronic stress. During the transition from acute stress to a chronic stress, the brain construct changes. The response is predicted by timing, individual variability, predictability, and controllability. The transition to chronicity and recovery are dependent on many factors, particularly of the individual susceptibility. So the brain, again, is very different. The stress networks, if you look at the acute stress and the chronic stress, simply looking at this itself, you'll know the amygdala is enlarged, shown here, and the hippocampus shown here in a big way. These are the 2 important structures. This subcortical structures become very predominant, whereas the cortical structures like prefrontal cortex and its influence get shrunken. So, in other words, from a top to bottom approach, the individual to the chronic stress is now controlled by a bottom to up approach. That's why it's constantly in a fear response and driven by fear and anxiety. So you differentiate between the acute stress and the chronic stress over a period of time because the brain, the way it processes is very different. And also chronic stress can produce, selectively can alter DNA methylome and chromatone compaction state. And this could affect the gene transcription in the central and peripheral pathways, causing a lot of mood and perception problems later on. We all know chronic, particularly early life stress, if it is chronic, can be associated with glucocorticoid receptor disruption. This can actually, the one which is responsible for gene transcription, it has a greater impact on the brain-gut axis. That's why one of the reasons you will find chronic stress is often related to gastrointestinal problems. So we all know this chronic stress. Children who are exposed to maternal deprivation, prolonged maternal deprivation, without the supportive relationship, are known to have adulthood problems. And this is something I think we need to understand, the importance of chronic early life stress and its consequences to later mental health. And stress and disease, a little bit, as Dr. Mishra said, I think stress disorders can certainly affect cardiovascular system, and having a severe stress disorder elevates the risk of multiple types of cardiovascular disease. Particularly, the risk is greater during the first year, and then it keeps, the association is particularly important in early onset cases. If a particular individual is having a cardiovascular disease before the age of 50, or by the age of 50, I think more often stress plays an important role. That's why cardiologists are very important, like giving a lot of importance to stress management these days, because younger people are having mortality and morbidity mainly because of stress and acute stress reactions. Gastrointestinal system very, very closely connected with stress. GI tract can produce movement disorders. It can increase the visceral irritability. It can alter the rate and extent of various GI secretions. It can modify the permeability of the intestinal barrier. It can have negative impact on the blood flow to the GI tract. It can increase the intestinal bacteria count also. So the normal flora can be affected, but then, like the increased intestinal bacteria count is also a problem. All this could lead to gastrointestinal problems. Stress disorders are also very significantly correlated with autoimmune disorders. Exposure to a clinical diagnosis of stress-related disorder is significantly associated with the increased risk of autoimmune disorder. So I think this is all, the data which clearly says that, like how stress and autoimmune disorders are very significantly related to each other. And not to say that some psychological disorders, many psychological disorders are associated with stress, adjustment disorders, alcohol, anxiety, depression, the whole variety of, like disorders. We all know about it. I think simply put in a cartoon, if you are fortunate to have a normal gene, if you develop normally, and if you develop normal circuits, so you have a supportive relationship, and then even if you are faced with stress starts, you may still have a normal, phenotype. Very rarely you have psychiatric symptoms unless the stress is very significant and quite toxic. Most people will escape if they had a normal gene and a normal development, despite the stress. But if you ever acquire a vulnerable gene and your normal development is compromised and you have a compromised neurocircuits and then you are exposed to stressful events, probably, you are more likely to develop from psychiatric symptoms. If you don't get exposed to stress and life events early on, you might escape that and get into a normal phenotype. So the various combinations are available. That's why we really want to allude about the relationship between stress and gene and environment and gene and the interactions and, the evolution of the psychiatric disorders. Finally, few thoughts on how to resolve stress-related problems. I think as mental health professionals, we want to tell people the perception is very important. So restructuring the cognition is critically important. Many of these people tend to magnify their weaknesses or stressors. They minimize their own resilience, their own coping ability. They're only focusing on the negative that has happened. They try to conclude on a black and white dichotomous thinking. They try to generalize everything. And for them, the feelings become facts. Thought becomes beliefs. So I think we need to really make these people believe that feelings are not facts, thoughts are not beliefs, and all that they are perceiving could be altered with this cognitive restructuring. So I do believe that CBT plays a significant role in a lot of acute stress disorders in actually making people to get onto this thinking paradigm of a different kind. Problem solving is critical for stress management. Defining the problem, brainstorm with all possible solutions, focusing on energy attention to complete a task on hand one at a time, identifying the various outcomes related to various solutions and making a decision, sticking on to it and sustaining to it. Also look at alternatives and evaluating the outcome. So problem solving strategies are done very well by many psychologists and psychiatrists. I think we need to look at how to resolve a particular problem. For many people with stress, particularly not having such a toxic level, relaxation exercises are critically important. We all emphasize on breathing exercises, how deep, slower breathing from the abdomen could be so important. Progressive muscle relaxation has been taught to residents right from younger days. Jacobson's muscle relaxation technique. Combining it with imagery is also very important. Regular practice is key. Many people do it for a few days, come back and report and say, I've not enjoyed the benefit. I think it's critical to tell people that persistent with this is very important. Sleep hygiene is a very important factor. I think we can talk about it. Stimulus control is very important. You have to ask people to go to bed only when they are sleepy and wake up at the same time, irrespective of how much time that they sleep. They don't try to sleep in your bed. Don't use bed as any other thing other than sex and sleep. So we need to avoid all the stimuli, other stimuli relating to having a television in your bedroom, having an anchor who is shouting at his throat to you is not going to be a good way to have a night's sleep. So try to avoid daytime sleep more than an hour. Sleep restriction is a good thing. increasing the sleep efficiency, that is time asleep as a percentage of time in bed. A lot of people spend a lot of time in bed, sleep very little. I need to reduce the time between them. And I think that's the best way to increase the sleep efficiency. These are all very important. And I think we need to really talk about stress coping. Physical activity is critical. I think in psychiatry in the 1970s when I joined, we never talked about physical activity as a critical factor. If you do not talk about physical activity today, you are really doing a wrong thing. Physical activity is so critical for mental health development, whether it's aerobic exercise, sports, or yoga, it doesn't matter. Mood regulation is critically important. I think negative moods lead to misguided decisions, unhappiness, and low self-esteem. Controlling mood regulation is a critically important one. We are beginning to talk a lot about positive mental health. This is a topic by itself. I love this particular topic. Attitudes of individual towards self. Actualization, autonomy, the perception of reality, the environmental mastery, they're all the factors involved in positive mental health. And I think we need to employ healthy mental mechanisms like humor, altruism, compensation. These are all very, very important, finest mechanisms. Many people during the COVID time, we suddenly found young people becoming so much altruistic, young doctors becoming so much altruistic, devoting their percentage of time, so much of time to people who are ailing and suffering without even bothering about them and their society. Their altruism is going to keep them healthy. And I think humor is critical because humor is related to changes in the 5-hydroxytryptamine, 1A, as well as oxytocin, the binding hormone. Bonding hormone. Everyone can develop a sense of humor. It's not as though that few people can only have it. There is affective humor, there's self-enhancing humor, there's this aggressive humor, there's the self-defeating humor. Laughter yoga, 20 minutes, non-stop laughter, you do it many times in the parks. There can also be therapeutic. Humor also tends to change the internal control. Okay, increasing the self-esteem is critical for a lot of young people, facing the fears, forgetting the failures, knowing what one exactly wants, being assertive, rewarding oneself, not comparing with others. Don't assume that everybody knows everything, asking people for help. Looking at alternatives and positive suggestions are important ways to go through. Lastly, I want to emphasize a lot of people here who can talk better than me about spirituality and mental health. But I think wisdom is something that people are talking about as though wisdom happens only in old age. And I think wise people need not be necessarily old. Homo sapiens, simply meaning wiser men. Really, I think we need to live up to that. We need to say we have to be wise. And one of the ways we can become wise is to be spiritual. Finding the meaning, finding the purpose of life, not necessarily when you are at my age of 66, but do it even when you are young. And then searching for the sacred, searching for the infinite, whether it is a religiosity, I don't care. But I think, to me, hope, resilience is critical. And that's what actually we are trying to invest through a global platform in Chennai, offering young people hope and resilience to elementary schools and primary schools and secondary schools. I'm surprised in the past 2 years, I'm working with SCARF, introducing hope and resilience in the curriculum of children and talking to them is making such a big impact. And I do believe this could pay. We did a cluster randomized trial in the schools, trying to do a school-based curriculum, and we are finding positive results. We can actually skill people with these things. We can skill people to be positively mental healthy. That's quite possible. So I think we really need to understand that young people can learn these skills very quickly and face stress and cope with it better resilient individuals in future. Thank you. Finally, I want to say stress is not, it's only common to some people. It's ubiquitous. It follows us everywhere at every span of our life. Understanding the neurobiology, particularly the difference between the way physical and psychological stressors are processed in the brain and some of the anatomical structures, and how this top to bottom approach is now turned to bottom to top approach, and how early life stress and chronic stress can impact on physical and mental health, and how most importantly to resolve them is all very important for us to learn. Thank you very much. I certainly want to thank the Indian Psychiatric Society for providing me this opportunity to talk to them. Thank you so much. I'll be very happy to answer any questions that you have on this topic.
Thank you very much, Sureshkumar sir. you have extensively dealt with, and the most simplistic way you have actually explained the different aspects of the stress, the neurobiological changes occurring in the brain and the behavior of the individuals, and how the resilience, the adaptive coping mechanism, and the positive defense mechanism has been helped to the individual in dealing with the stress in the different aspect, from chronic stress to the stress in the day-to-day life. So with this thing, we will go to the thing like any clarification, any questions from the participants. I'll just see what are the questions are there, and we can go one by one if there are any questions are there.
Salim sir.
Vishal, any questions? I don't see any questions.
I see. Alim sir. Alim sir and
Alim
Dr.
sir,
Panikram.
Alim sir, yes.
Mishra ji, can I ask a kind of a critical question to our speaker?
Yes, please, sir, go ahead. Sir.
Suresh,
Yes.
my question is a little more theoretical after, of course, going through your very beautiful exposition of what stress is and the neuroscience of it and the neurohormones. Can we consider mood disorders in general and depression in particular as a kind of a stressogenic, because your model of explanation of the neurobiology actually more or less covers the mood disorder neurocircuitry, especially the depression circuitry it is. So your comment on that. I personally think that, we can explain, especially the cortisol hypothesis and the stress response as the root cause for mood disorders. I'm not talking about psychosis. I'm talking about mood disorders and depression.
I think Dr. Prashad Rao, you're absolutely right in pointing out some of the overlapping things. This is what fascinates. I think if you go by syndromal approach, the typical that we know of in psychiatry, classifying psychiatric disorders in the way we do today, and try and look at the networks, suddenly you are getting very confused. And then you talk about some of the neuroscientists who are looking at basic research of neuroscience of emotions, neuroscience of basic emotions, neuroscience of stress. Then suddenly you realize there is so much of an overlap that is happening in the brain. Having said, I think stress scientists have done remarkable work for the past so many decades in trying to figure out how the whole response is generated in the body and the brain. Their work is a lot more sophisticated and lucid compared to what happens in the psychiatric research. I do understand the subcortical areas that we are talking about in mood disorders and the cortical structures we talk about in mood disorders are somewhat overlapping with the stress networks with some differences. We actually talk about it, certain areas very strongly in the mood disorders that may not be so significant, but I think they are overlapping. But I would want to say they are even identifying some areas within this and clearly pointing out where it overlaps much more to me is in the addiction field. The stress and addiction is a very important thing that has been happening over a period of time. And I think lots of people are now beginning to think how much stress actually plays a role in addiction and how much the stress networks are hijacked by an individual, and this contributes to the vulnerability of addiction. So is for mood disorder. I believe stress contributes to quite a lot of psychiatric disorders and in many ways. And I think it's not a very simplistic way. We need to really look at a very different lens and say how psychiatric disorders could be, categorized in future. Maybe we should have a look at it, borrowing our knowledge from the oncologists. The oncologists have done a tremendous job looking at their own things. I think we should go the oncology way in looking at many things. And unless we go there, we still are going to be very confusing. But your questions are very bright and brilliant because I think there is a bigger overlap.
And thank you. I would just add Thomas himself, who is a critic of DSM-5, who felt that our categorical diagnosis should not be the way which we should look at the psychiatric disorders, and we should look towards the other etiological basis diagnosis. And I am sure in the coming decade, we might do a better understanding on the change of our own classificatory system for a better understanding of psychiatry.
Sure.
Thank you, Dr. Alim and Panikant. You can take over. Any questions are there? Then you can close down after this question and answer session.
Question from Dr. Vidya. Does multiple medical interventions in a sick preterm baby increase the vulnerability of developing anxiety disorders in adulthood?
Can you repeat the question, sir?
One question from Dr. Vidya. She is asking, does multiple medical interventions in a sick preterm baby increase the vulnerability of developing anxiety disorders in adulthood?
It's a very hypothetical answer I can give. We all know any kind of a threat, physical and psychological, at a very early age can be a significant life stressor. So we give so much of importance to early life stress, not only prenatally, perinatally occurring. So if the child, if a newborn child is going to be undergoing many medical interventions, and if it is perceived by the body and the brain at that stage, if the body and the brain perceives it as a potential threat, and then the HBA axis is going to be, hijacked, and that's when the child becomes susceptible. And I think what it's going to be manifesting is very difficult to predict at this point in time, whether it's a stress disorder, whether it's an anxiety disorder. Well, I think it's the likelihood of developing a later mental health consequences becomes higher. That much I can say at this point in time. But I think, Dr. Vidya, the answer is the early life stress of any kind, which is perceived by the body and the brain as potentially threatening, is important. And that is what we should do everywhere to protect it, from happening. And something is not possible, sometimes it's not possible. Some unfortunate individuals will go through that, and there is no way we can stop it. And there's no way we can protect every single child. And I think we need to remember, some of it could also be buffered. And we are looking at epigenetic mechanisms, modification, and then I think it's biologically, or, for example, I was talking about the maternal deprivation. If that maternal deprivation, which is a threat, actual threat, is actually buffered by a aunt or a grandma giving that kind of a protection, that's going to be protective. It's not as though every child who lost the parent would go through that. It's something very similar. So supportive buffering relationship and support of any kind is actually going to be a protective factor. In some way down the line, we may also come up with some biological modifications, epigenetic modification, histonomethylation changes. All that is, are under trial these days, how we could modify this gene description at a very early stage.
So we have few questions from Dr. Ranjan Bhattacharya. Excellent presentation, sir. What are the neurological correlates of building resilience? That is his question.
Excellent question. I think if you look at what NIMANS is doing, and they're talking about, yoga as a big intervention. So much money has been pumped in. I used to be very skeptical about it in the beginning. Now I think and look at it, what does it happen with this kind of whether it's a positive mental health, whether it is a resilience, whether it is yoga, or the activity that you do, what is it you're trying to do? What you're trying to do is to build the cortical areas, the control areas. The brakes in the brain are getting strengthened. As long as you strengthen your prefrontal cortex, which is actually having the control over the reptile subcortical brain, which is the one which is, repulsive and acting like this. And if you can mute it, exactly the anxiogenic effect can be exercised. The stress reducing effect can be exercised by our own prefrontal cortex. That's where our relaxations, our positive psychology, our suggestions, our resilience all come into play. The greater prefrontal cortex at play, downing. So you need to regain the top to bottom approach. That's exactly the answer. So the neurobiological correlates just opposite of it. And I think there are pointers. Now, I think Dilip Justice's work on wisdom, and then some people are now trying to look at and say, what is that some people are wiser than others? And we believe that, these are the people who have a bigger prefrontal structures, particular areas, prelimbic areas, and they are able to exercise the control better than others.
So one more question, sir. Thank you, sir. Question from Dr. Padmapriya Chandran. Sir, can you throw some light on COVID stress syndrome?
No, I think, I think we are attributing to COVID at this point in time because they're currently in the pandemic. any stress of any kind. I don't really think COVID has gone through a different response than any chronic stressor would undergone. But this is a kind of a stress that nobody has ever seen collectively. Collectively, so many people in the world has not been affected at one given time. So it's a kind of an unprecedented crisis that we are going through at this point in time. So obviously, people have gone through a chronic stress. It's not really related to only COVID infection, unfortunately. It's not just the COVID infection. The consequences, the actions taken, initiated by governments and regulatory authorities for COVID has actually produced a lot more stress. We did a survey among younger people. And then, really the response is, it's not that COVID has produced so much of a response. It is the restrictions that has been associated with that. The loss of job that has been associated with that. The loss of, time that with the friends and social connectedness has been lost. So there are so many other issues. That's why people are in a hurry to get out and meet with people, get on to jobs, because that's more stressful to them. So it's a combination of both infection and what it does to them, and more importantly, the consequences of it. Early on, it was a lockdown experience. Now it is a loss of job, loss of economy, disruption of everyday life, and loss of some critical family members, and then those social connectedness being lost. All these combination of factors have resulted. I think we also know. I'm working very closely with the people who are dealing with COVID, and people will tell me, people who really take this infection head on and then deal with that with a cheer in their head. I mean in their ways, they probably deal with that much better. Probably the immune system also get altered the more resilient you are. Obviously, they're all connected, right? So stress can mediate the cellular permeability, excitability, immune responses can be, in the storm can be very higher. So obviously, stress reduction. That's why people are also emphasizing. Mental health professionals are consistently talking to people in the COVID ward. It has a relevance, right? It has a lot of relevance. So I think at the moment, I think many people, mental health professionals, have done a tremendous job in many settings offering help to people in the COVID wards. I think it's been very useful. I don't know whether Padma, I've answered your question that you wanted.
Yeah, sir, thank you so much for a nice presentation. Actually, I have to leave to start another webinar on neural circuits. So it will actually cover what you are saying. How do we look at our brain? We look at the neurobiology, how about the neural circuit is responding. So I very much agree to you what you're saying, that we have to change our perspective a bit also. We have to come out of this checkbox thing, that 5 out of 10 thing, that is a very small part of the big picture. So thank you, Suresh sir, Dr. Vishal Mishra sir, Panikant bhai, OP sir, Gautam Saha sir. Thank you so much, sir. I'll be taking your leave, sir. Thank you so much.
Thank you so much.
Thank you, sir. Thank you, Alin, sir, for attending.
So we'll continue with the questions, sir. So we have a few more questions.
Yeah.
After you finish the question, then we can come to close.
Yeah. So a question from Dr. Madhu Vamsi. As a student, how do we move towards spiritualism? Very interesting, sir.
Very interesting.
I think people shouldn't get confused religiosity with spirituality. They are two different things. I'm a non-believer. It doesn't mean that you cannot be spiritual. So I used to work with addiction, and then in the AA, people will say, for those who do not believe in God, God is simply, good, orderly direction. So it could be anything. Good, orderly direction could be your God. So I think being spiritual is exactly understanding the purpose and meaning of life. And the purpose and meaning of life comes when people look at the values that you imbibe as a young person. It largely comes from the family and the culture that you belong to. But I think we are all, as human beings, carry the same values wherever you are, wherever you are born, whatever race you are, whatever religion you belong to. That fundamental qualities of what the life is all about, what is right and what is wrong, and what's the right value, is what actually determines spirituality. You can actually talk about it in so many ways. And I think beginning to tell younger people, that's exactly what you're doing when you go to schools. Schools have largely focused on academics, made people to become very stressed. And then why do they give so much emphasis to education and academics and then marks? Because you can become somebody. Somebody becoming somebody means you get a nice job, which means it's such a comfort associated with that. So people turned material comfort as happiness, and they are not one and the same. And I think we are beginning to tell children, If you help somebody, there is great pleasure in that. If you help somebody, like who doesn't have a pencil, you give them a pencil, it's going to be very helpful. I'm surprised we work in the corporation schools, the most disadvantaged populations. But I think these children are getting a lot more values at this point in time by what you're doing. So that's the kind of a spirituality you're talking about, not necessarily you're trying to talk to them and then shape them. I think that belief in purpose and meaning of life and doing good for himself and others and having certain family and cultural values is critically, I think, important. Depending on where you come from, the way you see it may be different. It doesn't matter to me. As long as you understand that and suddenly not be driven only by a materialistic, need-based kind of a drives. And then you're also looking at you as a person in the society wanting to help someone else to carry someone else also along with you. That's the kind of a thing that would go to be productive. We all know that, positive mental health aspects are nothing to do with material, nothing to do with the kind of a reward that you're talking about. So we need to make people to differentiate. You need to go away from the pleasure to happiness. Pleasure would be another chemical and happiness could be another chemical. So we need to change the way the brain is looking at what you're looking. Yeah. Not just be hedonistic. I want high, I want a pleasure. And I think that's all temporary. That's all very temporary. I don't know. I'm not a great specialist in spiritual areas. This is my understanding. I think young people, I do believe that it is not as though the spirituality should come only when you are older. In this great country, I think we have got very young people turning very spiritual, very young on. Young Gautam Buddha became spiritual. It's not a old Gautam Buddha who became spiritual. Young Gautam Buddha became spiritual. This is the same country. Young Adi Shankara, became spiritual. And so this is a country, young Vivekananda became spiritual. And I'm sure, there are so many young minds out there who are actually spiritual.
Thank you, sir, for the beautiful explanation. We have a question from Dr. Shalini. It's in the practical setup. In primary care setting, is there a standard questionnaire we can use to identify stress in our OPDs? This is the question.
That's a great question. And I think, Dr. Shalini, wherever you are, you send me an email and I can probably, send few things, none of them are to my satisfaction. There is no simple way in which you can call out, because it's all depending on when you talk about stress and when somebody is responding, we need to ask certain things. What is the stressor? What is the perception of threat? And what is the response? And what's the mechanism you employed? Only then you can come to again a conclusion. Actually, what you think as stress, I went when tsunami happened, I was holidaying. I didn't even know. When I came back, my mother introduced a guilt in me and said that when the whole world is suffering and my neighborhood is suffering in Chennai, you went on a holiday. So me and my wife went to a village, a hamlet, and we stayed there and worked for about a month there. And I thought all the fishermen would be suffering with PTSD. And where I went and found, I had more stress than them because I didn't know how to live in a village, and then, where only fish was available as a food. And I was suffering more. And I then realized that acute stress disorder wasn't very common among them. A very small percentage only had. So they were more resilient than I ever imagined in my life. So what was the thing that really made them resilient, which did not go through the stress? So I would have imagined universally everybody would have gone through the stress. And I actually published that work. The only non-drug abuse related work that I did is a tsunami-related PTSD. And I got published in the American Journal of Public Health with an impact factor 25, just because I said PTSD and acute stress disorder not common in our setting. It's so low because our fishermen have greater resilience because for them life is so meaningful. They live one day at a time. I go to the sea and I may come back alive or not. It's really that not shatter me. Even if I lost my child, I'll say my sister's child is still alive. She's also my child. That kind of attitude is very fascinating. And so we found a very low incidence of, prevalence of, acute stress disorder among them. And it is reported, is published, in 2004, just after tsunami. So I learned at that time, it's not easy to detect stress in just people with a questionnaire on. That's why I'm just wanting, you want an interest questionnaire, I can send it, but it's a little subtle thing. I feel that, you can't imagine that everybody will have the stress just because they have gone through that experience. The perception and the response is different. As Dr. Mishra initially said, individual variability and susceptibility is critical.
Sir, one more, sir. I request our IPS Vice President and President-elect, Dr. Gautam sir, kindly say a few words about this program, sir.
Good evening, ladies and gentlemen.
Dr. Suresh was, as usual, fantastic. Always, I am a very big fan of him. As a speaker, he always delivered the best. And today was one of the best. I have listened to him, and definitely I learned a lot from him. Not only today, from very beginning, he's a very great speaker. His presentation style is very good, and content is always very good. And it is really very important to know the neurobiology, the neuroscience behind the anxiety and stress disorder. Because if we know that, then it will be very easy for us to treat this patient whenever the drug therapy or biological therapy is needed. Thank you, sir. And thank you, Bishal, Dr. Machisala, Dr. Shukla for the committee. And thank you, my dear friend, Dr. Kirat Misra, my elder brother, Dr. Prasad Rao, and all of you for organizing such an excellent program. And Dr. Fonikant, all of you, you have done wonderful job. I want you to continue this type of program under next coming years also. And I'm really proud of you all. Thank you so much.
Thank you, sir. Thank you, sir. Sir, with
Thank you, Gautam, sir.
permission, sir. Sir, with Mishra sir permission, sir.
Yes.
Sir, I request Dr. T.S.S. Rao, sir, our
Sir
General
is
Secretary.
there.
Oh, sorry, Dr. T.S.S. Rao is there.
Hey.
Sir, my pranam.
Listening to Suresh Kumar is always a
Pleasure.
very pleasurable job and quite orgasmic it was. The stress management and this particular topic is very close to my heart, and we do conduct various stress management programs and all of that. Biologically related issues and all we talk. But what you spoke today was a real eye-opener, and so many nuances are involved. What happens in maybe a physical stress or maybe psychological stress, and not only that, how to manage each of them. That was one of the real good this thing, the carry home message what you have given. I really loved it. Initially, I was thinking patients are there, then I made them quite sit outside for a little while and try to look into all these things. Slides were great and really good. As Dr. Rajkumar has mentioned in the chat, if you can share the slides, it will be really good.
Sir, I will be handed out to Ramya and Dr. Vishal. It's all in public domain. Anybody can take it, sir.
Beautiful. So nice.
No, like I do it. Anybody can use it. No problems at all.
Thank you so much.
Permission.
Thank you.
It was as though it was a physical program and we are listening to you, but very close range. Thank you very much.
Sir, thank you, sir. Sir, one more thing, sir. Sir, I request Dr. Prasad Rao, sir, kindly say few words about this program, sir. Prasad Rao, sir. I think, sir.
Not there.
Sir, over to Mr. Sir.
Thank you very much, Suresh Kumar sir, for extensively dealing with a subject. The most difficult and intricacy in this subject has been dealt upon, and how it can be like a learning lesson for all of us, how the most difficult subject can be put in a more simplistic way, and it can be explained to even the general public. And the most difficult neurobiological concepts of stress and its management has been dealt very extensively. Thank you very much, sir. And thank you very much, Dr. Bishal, Dr. Shukla sir, Dr. Machiswala sir, and the whole group. Bishal is doing a great job by arranging this sort of public awareness programs, which will be very helpful for the not only for the psychiatric community, for the medical fraternity, and to the public in general. It is very extensively dealt and very simplistic way. Thank you, Prashant and Alim, for their active participation. I thank all the office bearers of the IPS, Professor Dalal sir, Dr. Gautam, and Dr. T.S. Rao sir, OP was there, and all my friends. And extensively, Prasad Rao sir has given a very good brief over the topic. Thank you very much. And we wish Vishal can handle more and more this sort of program for the awareness of the community and the other medical fraternity. Thank you very much, sir. Thank you, everybody. Good night, and wish you all a happy Diwali in advance.
Thank you, sir. Thank you, sir. And now I request Dr. Fanikant, member of Public Education and Awareness Committee, to deliver the vote of thanks. Dr. Fanikant.
Thank you very much for the opportunity. Yeah, ladies and gentlemen, a very good evening to all. it gives me immense pleasure to deliver the vote of thanks to all the dignitaries attended today. I would like to thank our chief guest, Dr. K.K. Mishra sir, for really accepting the invitation and making his valuable presence and doing the honors. I would like to thank our speaker, Dr. Suresh Kumar sir, for his expert talk, which is backed by evidence and experience. It was really a fruitful session with a lot of insights into neurobiological aspects and management aspects of stress. We enjoyed your talk like every time, sir. I have been your admirer always for the way you deliver the content. Thank you, sir, for making a stress-free impact. I express my gratitude on behalf of Public Education and Awareness Committee. I would like to thank our patron, Dr. Prasad Rao sir, Dr. P.K. Dalal sir, President of IPS, Dr. Gautam sir, Vice President and President-elect of IPS, Dr. T.S.S. Rao sir, General Secretary, Honorary General Secretary, Dr. O.P. Singh sir, Honorary Editor, and our Public Education Committee and Awareness Committee Chairman, Dr. Machiswala sir, Co-Chair, Dr. Shukla sir, Convener, Dr. Vishal sir, and our members, Dr. Alim Siddiqui sir, Dr. Vijay sir, and participants, consultants all over the country, enthusiastic audience, the technical team, and last but not the least, the farmer people for contributing to the success of this webinar. Thank you for the overwhelming response as viewership has crossed the 300 mark. That's a huge participation which reflects the stamina of the speaker. Once again, I thank one and all for attending this program. I request Ms. Ramya, Linux Pharma, to few words. Good night.
Thank you, sir. Thank you so much. Thank you, sir, Dr. Suresh Kumar, sir, and Dr. Vishal. It's an immense pleasure that we have provided the platform to you. It's a great honor, sir. Thank you so much.
Thank you very much.
Thank you, everybody.
Thank you. Thank you.
Mr. You are in the
sir.
dark room.
Suresh Kumar sir, personally, I thank you for the wonderful presentation, sir. It was really a visual treat.
Absolutely.
It was excellent. It was excellent, sir.
Thank you, sir.
The way you answered the questions, I mean, it was crystal clear. It was very lucid. Thank you, sir.
Thank you.
As always.
Thank you, sir. Thank you all, sir.
Always
Good night, sir.
kind words.
Thank you, Vishal bhai. Thank you.
Thank you, sir.
Thank
Thank
you,
you for
Dr.
coming,
Punikar.
sir.
Thank you, Mishra sir.
Good
Thank you
night.
for being there as a moderator. Thank you, Dr.
Thank you,
Gupta.
Suresh sir, Mishra
Thank
sir,
you. Dr.
T.S.
Rao,
Rao,
nice
sir.
to see you after a long period. I'm so happy to see you. Okay, thank you.
Dr. T.S. Rao.
Hello. So tomorrow we are meeting again.
Again.
Suresh, it was real great, excellent presentation. Thank
Yes,
you.
sir, yes, sir.
Thank you, sir.
Thank you, one and all. Thank you very much. Yeah.
Thank you, sir.